Can we end the pandemic with a pill? Hi, I'm Abe, Associate Professor in the School of Nursing at Western University, and here on What the Health, I want to make your healthcare questions clearer. So, big news these days are antiviral treatments. You may have heard about 3 weeks ago about Molnupiravir, and then more recently from Pfizer, we've heard about Paxlovid. These are two treatments that are showing promise in terms of preventing hospitalizations and deaths from COVID-19. So I want to unpack antivirals, look at what the science shows us on these, and what we can hope from the future in terms of treatment and maybe even ending the pandemic. So I want to start with addressing an issue right out of the gate with it, which is the idea around treatment versus vaccines. And so there's been some concerns that I've heard amongst those who are resistant or hesitant around vaccinations that we haven't been looking at treatment enough. And they're saying, why isn't more done about treatment? Why are we just focusing on vaccines? Well, that's actually totally false. Treatment has been a focus right from the outset. From the very first cases, we've been trying to figure out how to help people. And that's been everything from working with clot busters to thinking about how do we position people while they're ill, to things like antivirals, corticosteroids, monoclonal antibody infusions, plasma infusions, all sorts of different ways we can help people through the illness and try to minimize the risk when people do get sick. So there hasn't been a lack of focus on treatment, and one of the things that has been studied right from the get-go is antivirals. And so I want to talk specifically about Ivermectin, remdesivir, Molnupiravir, and Paxlovid in this video as some important conversations about antivirals. But before I do that, I want to speak about antivirals specifically because unfortunately the problem is that antivirals just aren't that great of a treatment overall. Especially when we think about using a pill to treat some kind of a disease, we often think about antibiotics. And antibiotics are often highly effective. And that's because bacteria are alive. And because they're alive, there's a lot of ways that we can inhibit or destroy them. Viruses are different. Viruses are these little bundles of RNA or DNA that actually live within our own cells. And because they just sit there and replicate and they themselves are not alive, there's less ways that we can actually affect them negatively. And one of those ways that we often work on is just trying to prevent them from replicating more and more. And so because of that, you can actually see how pandemics are changing over time, across centuries, as well as from around the world, and how high-income countries that have access to antibiotics basically don't see disease outbreaks that are bacterial. We're seeing more of a shift to viral diseases, and that's likely to be the pandemics of the future are going to be viral. And that's just because we don't have as effective treatments. The problem with antivirals is that they often have negative side effects. And so maybe you have something that can destroy the virus, but it's also going to destroy the host as well, or the person in this case. And so there's no point in giving something to someone that's just going to harm them as well. Or there might be viral resistance, or they may be incredibly costly. So there's just a lot of things about antivirals that are unfortunately less beneficial than things like antibiotics that we use against bacteria. So let's look at some of these newsworthy antivirals. The first one I want to talk about is Ivermectin, and you might be thinking, Ivermectin, what are you talking about? That's not even an antiviral. That's an antiparasitic drug. But actually, the whole way that Ivermectin became part of the COVID-19 discussion is that in lab tests, it has been shown to have antiviral action against several RNA viruses. And so there was actually some logic about thinking, does this work for COVID-19? Now, the problem is that the lab tests and the human reality are very different. And what you would need to do to achieve that antiviral action from the lab in a human is basically give ivermectin at around 100 times a safe dose for humans. And so this gets back to what I just said about antivirals, is that they can be effective against the virus, but they can also harm the host. And so this created this situation where people were actually looking at the outcome of the science on ivermectin, and they were trying to calculate, okay, this is the effective lab dose, so if I'm going to medicate myself with ivermectin, this is how much I have to take, and poisoning themselves by taking these huge doses of ivermectin. Or the other really unfortunate thing that happened was that doctors who were less ethical were saying, okay, I will prescribe you ivermectin at a safe human dose, which is basically so low that it's not going to have any effect. So it's like giving someone a tenth of an Advil who's going into open heart surgery. It's just ineffective. And there's a real ethical problem I have with giving someone a medication that you know isn't going to work at the dose you're giving it. And so that's why ivermectin just doesn't work. There's just no safe way to give it that it destroys the virus and doesn't harm the human. The next one I wanted to talk about is remdesivir. So remdesivir is a very broad antiviral, so it works for a lot of viruses. And so they've been trying this out in COVID. And again, there's been a bit of this unfortunate side effect of those who are kind of skeptical about COVID-19 is that people have been going into hospital. Part of their treatment they've been given is this remdesivir, and then they continue to progress into their illness and maybe they die. And so people blame the remdesivir. They say, don't let the hospital give you remdesivir. My uncle had it and he died. Forgetting this, of course, that the progression of the illness was already happening and that it's not the remdesivir, it's the COVID-19 that killed someone. Remdesivir just failed to prevent the death. It didn't cause the death. And that's essentially the problem with remdesivir, is that it isn't having a huge impact on minimizing illness. And so they did a clinical trial on this, and essentially what they found was a reduction in hospital stays for people with moderate illness from about 15 days to about 10 days. And so essentially what it's doing is it's reducing the severity of that illness, probably in some cases. And so, I mean, this is just the story of antivirals, is that they work okay, but they're not the same kind of curative thing that we see with antibiotics. And so for remdesivir, they're going to continue to use it, get more data, see if there is enough efficacy to justify continuing to use it, although the impact seems relatively low. So let's talk about the new kids on the block then. These are from Merck and Pfizer. They're the Molnupiravir and the Paxlovid. And these are big news because they've been showing some early results. And some people are kind of holding these up to be the big saviors of the pandemic, especially those who don't want to get the vaccine or want to minimize the use of vaccinations. They're saying, hey, look, we may have a solution here. These antivirals may be enough that we don't have to get vaccinated. We can just treat people as illness arises. And so let's have a look at a little bit of the data that came out of this. With the Molnupiravir, essentially, you've probably heard data around of reducing hospitalizations by 50%. Which is what they found in the trial. Now, unfortunately, it was a pretty small trial, only 775 participants. So there's a massive margin of error in a group that small. And it was led by the manufacturer. It still hasn't been peer reviewed. But the most important part is that the efficacy came when they found the illness early and it was mild. So if you can get someone when they first have that bit of a fever, they first have that bit of a cough, you can get them the treatment, you can reduce the likelihood that they are going to end up severely ill. And so they did another trial out of India where they started with moderate illness and they actually had no impact on that use. And so it's kind of similar story to the remdesivir, right? Is that it's probably a degree of efficacy here. It probably helps, especially if we catch things early. So for Paxlovid, the data looks actually a little bit better because they had a larger trial, 1,219 people. And from that, they had only 0.8% hospitalized. They had no deaths among the treatment group. Those who had the placebo, they had 7% hospitalization. They had 7 deaths from that group. So again, this data has just come from the manufacturer so far. It hasn't been reviewed. FDA hasn't looked at it yet. It hasn't even been submitted yet to Health Canada. But again, it does look promising that if the illness is detected very early, and while it's still mild, if we give people antivirals, we will reduce their likelihood of severe illness. So I think the big story for me is that antivirals work, but they continue to be not as great as we would like them to be. I mean, it'd be wonderful if once someone is ill, no matter how severely ill, we could give them a pill that was going to get rid of the COVID-19. But our whole history of working with antivirals says we shouldn't expect that. That's just not, unfortunately, how they work. We'll keep, of course, studying and keep looking for the magic bullet, but for now, of course, we need to continue to balance the prevention and treatment. And so that's why I'm suggesting that our frontline activity, the first defense, has to be our vaccinations, the vaccination that prevents the illness in the first place. Should illness arise, then it's great that we continue to expand our treatment options and reduce the likelihood of severe illness or death. But the antivirals aren't going to prevent the transmission within the community as well. So essentially, you don't end a pandemic with a pill. You end a pandemic with a vaccination, and you minimize the impact of that pandemic with pills and other treatments. So that's what the health is going on with antiviral treatments for COVID-19.